Hello and welcome to 18WJTS in.form. I'm your host, Bill Potter. Mental health is a serious issue in this county and all throughout the United States. Joining us in the studio is Jodi Richardson and Donna Oeding. Jodi is I'm going to get this right, the Director of Behavioral Health at Memorial Hospital and Healthcare Center.
Yes.
And Donna is the Director of the Du Bois County Health Department.
Correct.
However, these ladies are here today joined together as co-chairs of the Mental Health Committee. Because you do classes, there are classes that you're part of, and they're called Mental Health First Aid?
Correct.
Is that the classes? Okay, we're going to talk about those classes in a moment. But I guess first of all, we should talk about the need. Where and why is there a need in this area for mental health intervention?
Well, I'll start first that the Du Bois County Public Health Partnership in 2016 did a community health assessment and a community health improvement plan. In both of those documents, we identified mental health as one of the top issues in our county that needs to be addressed. We have had a suicide prevention coalition in the county for years, and we started a mental health committee several years ago to address different issues that we see in our community that need to be addressed. One of the things that we came up with is we needed somehow to inform our community about mental health, to try to reduce stigmas, to try just to gain awareness of this issue in our community. And that's why we decided on mental health first aid. And I'll let Jodi discuss that a little bit more later. But the committee then decided we got a grant from the Area Health Education Commission from USI to send 4 people to training to become trainers in mental health first aid. And they have come back, and we just did our first classes in August,
okay.
Thank you. And we had 13 people attend, and that's a perfect size for us to get started with our mental health first aid classes. Our 4 trainers are Kara Glendenning from Memorial Hospital, Crystal Linetti from Meyer Distributing, Amy Dilger from Best Furnishings, and Kim Dietz. They all went to 5 days worth of training to become certified trainers in mental health first aid, and they, I think, will be fabulous trainers of this program.
Jodi, you're working at the hospital. You see, unfortunately, the end result of mental health that has not been addressed.
We do. We continue to not only see firsthand, people who are suffering with mental health issues that may ultimately require either outpatient or inpatient services to stabilize those, but then also, field numerous phone calls on crisis lines of family members wanting to know how they can help their loved ones who are suffering with mental health issues. And so in partnership, with the Du Bois County Public Health Partnership, we decided we really needed a broad-ranged education program to be able to provide that education across all aspects of the community. And so we researched what program that ultimately would be and decided that mental health first aid, because it's supported by the National Behavioral Health Council, it is an evidence-based program that teaches a general understanding of mental health issues, to the layperson, not to a mental health professional, but to anybody. And so we have worked as a community to target focus groups in regards to where we want to be able to provide this training, but ultimately we want to be able to serve Du Bois County to broaden our awareness of that understanding, and then to allow people to then support first-line interventions to mental health help. And so we're hoping that a focused area of training and education and understanding how to access the system will prevent suicides, will prevent more severe illness, will prevent loss of income for families, loss of productivity for the workforce. It just really has the trickle-down effect. And so we're hoping that this education program within our community can just help all aspects and all members to really understand what's going on.
I think nationally, all of a sudden, mental health is the buzzword. Everybody's all concerned about mental health, which we should have been for years. Is Du Bois County any different than other places in the United States?
We're actually not any different. And I grew up here. And so sometimes it's, I think, a little surprising. Maybe you were sheltered. But ultimately, what we know about mental health is that it doesn't pick or choose. It doesn't choose race, it doesn't choose sex, it doesn't choose income status. And so our numbers of the data that we see in regards to assessments and diagnosis fall in line across with national statistics. Suicides specifically, as Donna and I work with the coalition, are obviously much higher than what we want them to be. We want them to be zero. But nationally, again, our suicide statistics are right in line with what other areas would see. But I think within our community, we have a culture that sometimes doesn't support being able to talk about our problems openly. And stigma associated with mental health specifically can be very challenging. And so if we can get people to talk about depression like they talk about cancer, that's our goal. Mental health, whether it be a substance abuse problem, a depression and anxiety, a bipolar disorder, or schizophrenia, all of those things are a medical illness and a disease process. And so it's a disease process of the brain that people need treatment for. And so we have got to, as a community, get to the point that we can speak to mental health and mental illness without a stigma being attached. And we're hoping that that's what mental health first aid will help us to do.
Okay. And mental health first aid is a program? It's like a national program. I could go to Colorado and they'd maybe have the same program.
Absolutely. So it's a national evidence-based program that ultimately teaches people the skills that they need to assist someone in developing, assist someone who may be developing mental health problems on that first line intervention again. So it's geared for the lay person. It's not geared for a mental health professional. It basically builds mental health literacy. It helps the public to identify, understand, and respond to signs of mental health issues, and ultimately, again, increases community awareness. And so the program is taught out of actually like a course book that Donna has with us that uses an algorithm called ALGE. And ALGE is a 5-step action plan that provides support to someone experiencing a mental health or substance abuse problem. And so ALGE stands for, the A is assess the risk of suicide or harm. The L is listen non-judgmentally. The G is give reassurance and information. E is encourage appropriate professional help. And the second E is encouraging self-help and other support strategies. And so they teach this class based off the ALGE model, and they will teach it for the chapter on depression, then the chapter on anxiety, then the chapter on bipolar disorder. So it's a repeat model that then is applied to a spectrum of mental health issues that really helps, again, that lay person be able to grasp what are the steps that I can do for earlier intervention. We don't expect that person to be a professional, but we want you to be able to recognize the signs, the red flags. How many times have we heard, I knew there was something off there, I just couldn't put my finger on it. We're hoping to help people identify the early signs so they can put their finger on it to get that person the intervention and the assistance that they need.
Well, then I guess, who are you hoping takes part in these classes? And are these classes offered really different times throughout the year? So even though you're watching this now, and 6 months from now you feel like you'd like to take the class, just contact the health department. Right?
You can contact me at the health department, but yes, we are trying to reach out to businesses, to different community groups, to nonprofit agencies. Really, anybody and everybody can take this course. It is not limited. We'll look at our law enforcement, those kind of people as well, because we know they are, deal with this every day. Like I said, we had our first set of classes in August. We have a set of classes that is scheduled for September. That class is completely full already. So we have 4 other classes scheduled. The first one is going to be on November the 15th. That will be an all-day class. The thing people need to remember as well, this is an 8-hour course, and you have to participate the entire 8 hours to complete the course. So the November 15th is an all-day course. It'll start at 8 o'clock in the morning. We'll have a short break for lunch, and it'll go till 4:30 or 5. January 23rd and 24th, we're going to do it from 8 to noon. So it's 4 hours, 2 days in a row. March the 14th, again, will be a full day training. And then April the 25th and 26th from 8 to 12. If we have different businesses or groups that want to come in as a group, they need to let us know that. So we try to keep our classes, and we have to have at least 10 to 15 people in it, but we don't want them to get too big so that it's manageable as well for our instructors.
I think the thing to remember about these efforts are we're hoping that this will be ongoing, that this is something that for the next several years, our goal is to offer 6 trainings a year for the community. And so again, whether that be special interest groups, somebody who would have a role in maybe helping other people who might have problems. We have targeted businesses, so supervisors, industry leaders, human resource people, the people within those organizations who, in management, you spend a lot of time managing people and not necessarily managing processes. And so we're just, again, hoping to raise community awareness for years to come. So this isn't a one-time offering of 5 or 6 dates. Mm-hmm. This is going to be something that hopefully year after year we can see this within the community to continue to build on our need for mental health awareness, again, reducing the stigma, encouraging people to get the help that they need.
I think one other thing I would like to mention is that we are working with the schools as well.
Okay.
This is what we are teaching right now is the adult version of mental health first aid, but there is a youth version. And we are getting people that are going to be trained in the youth version and going to be presenting that for the schools as well, because it is a little bit different for the youth than it is for adults. So we're real excited about that as well, and we know there's a great need for that. But there is a cost to, there is a registration fee for the class. It's $35. That pays for the book and any other ancillary type of expenses we might have to put on the class.
Well, that's very reasonable, really.
It is.
Yes.
In other communities, actually, they're charging up to $175 for this 8-hour class because it is actually a certification class. And so you become certified in mental health first aid. So you're given a certificate of completion, which again is why, the 8 hours of attendance is required. And so we really feel like with, having been able to have the support of the partnership and AHEC, that we're able to provide this class offering to the community for a very low cost.
Okay, and even though you mentioned dates, be thinking that if you're just interested, call and get yourself on a waiting list would be one thing.
They
right?
can, or they can go to mentalhealthfirstaid.org. There's a great website with a lot of information on it. You go to take a class, I believe take a class, find a class, you type in Jasper, it'll pull up our classes. Right now the only one we have is the November one that's on there that they can register for, but it gives them that information. So, but if you're interested and you can't come in November, you want us to remind you, we will continue to put this information out through the press and in as many different ways as we can. We're going to message to the businesses through their HR departments. So we want this information out there. But if you do have any questions, please don't hesitate to call me at the health department. My number is 481-7050. We'll be happy to try to answer any questions you might have. And if I can't answer it, Jodi and or the trainers are much better at the actual course material than I am to answer those specific questions.
Okay, well, ladies, thank you very much for coming in. Make sure that you think about registering for that, especially if you are in a position where you can be working with people and you need to recognize some of the symptoms of mental health. Some can be small and some can be big, and sometimes we need to start it at the small level, right?
Exactly.
We have had with us Jodi Richardson. Again, I have to look at the paper because you're the Director of Behavioral Health at Memorial Hospital and Healthcare Center, and Donna Oeding, the Director of the Du Bois County Health Department. But together they are the co-chairs of the Mental Health Committee for Du Bois County.
Right.
Ladies, thank you very much for being with us. Contact them, let them know that you'd like to take part in mental health first aid. Thanks for watching WJTS. We're local people watching local people.